We are getting started today with our presentation on SOGI best practices for clinical use and data. We are very excited to have everybody here today. CMEP is made up of our multidisciplinarian team. We want to give special thanks to NAMI today. We have Monica assisting with this presentation. We're very excited to be able to partner with all our great partners on our multidisciplinarian team. And so today we're going to be talking a lot about trauma-informed data for equity and really trying to get our core values within the presentation. So that's something that we would also like to see from our participants. So please in the chat, make sure that you are aware and being trauma-informed and utilizing your pronouns and then others' pronouns correctly. And then I will allow Monica to introduce herself.
Hello, my name is Monica Rodriguez. I'm the Community Engagement Programs Coordinator here at NAMI, California. I've been with NAMI for almost 2 years now, supporting the programs and working with partners to make them more culturally and linguistically competent and providing support to affiliates as well. And I'm very excited to be here with you all today.
And I'm up next. My name is Alex Filippelli. I use he and they pronouns, and I locate myself as a queer and trans person and as a white settler and documented immigrant. I hold an MSW from the University of Victoria, Canada, and I've been working in trans care in direct service and also training mental health and medical providers for about a decade. And currently I'm with the Center for Applied Research Solutions as a TA specialist on the CMEP project, the project that you're here to join us on today. I also am a co-director of the LGBTQ TA Center for the California Reducing Disparities Project. That is another project that we have.
And I am Leah Tolchief, she, her pronouns. I have a master's in psychological sciences, specializing in data, particularly clinical data. And my lived experience comes from Native American and LGBTQ communities. And I am very excited to speak with everybody today about SOGI data. So we will get started talking about some of our learning objectives that we have for today. We are going to be asking you to practice asking and document data using culturally aware and responsive and trauma-informed approaches. And then we're going to be talking a little bit about the laws, policies, and best practices regarding SOGI data collection and how those impact how data is collected and why we collect the data that we do. And then we're going to be talking about applying current best practices to help develop tools and improving your services. And so in order to do that, we're going to be first talking about culturally responsive and trauma-informed approaches to collecting SOGI information with Monica. And then Alex is going to be giving you some information about laws and best practices. And then finally, I'm going to be talking with you about utilizing and analyzing the SOGI data once you have it. So I will go ahead and shift it over to Monica.
Okay, so let's just go right into cultural responsive and trauma-informed. Oh, sorry, I went back. Trauma-informed approaches. So SOGI, standing for sexual orientation and gender identity and expression. I'm going to talk about what SOGI inclusivity means, the importance of being culturally aware, and applying current best practices to help develop tools. So what is SOGI? Sexual orientation refers to a person's emotional, romantic, and/or sexual attraction to others. A person's sexual orientation is usually understood to be an inherent aspect of their identity and is not something that can be chosen or changed. Gender identity refers to a person's deeply held sense of their own gender, which may or may not align with the sex that they were assigned at birth. Gender identity is typically understood as a spectrum, with people identifying as male, female, non-binary, genderqueer, or other gender identities. Like sexual orientation, a person's gender identity is often seen as an intrinsic part of their identity and is not a choice. Gender expression refers to the way that individuals express their gender identity through their appearance, behavior, or communication. And then also sex assigned at birth. So the original sex designated or assigned to a baby based on visual examinations of their genitals typically reflected on a birth certificate. Everyone has a sexual orientation or gender identity, or SOGI. This is an inclusive term that applies to everyone, whether they identify as lesbian, gay, bisexual, transgender, queer, two-spirits, heterosexual, or like cisgender. But it's important to note that sexual orientation and gender identity are not distinct concepts, although they are often related.
Thanks. I just wanted to chime in here with a couple other kind of foundational concepts for folks to have a grasp on that we're going to talk about today. So sometimes we talk about gender transition or gender affirmation, and that can look like three kind of different buckets. It can look like social affirmation, which can include using a different name or pronoun, and folks may do that in their friendship networks, their school relationships, at family or work, or in some or all of these places. Social affirmation also applies to LGBTQ plus people. So based on your sexuality or gender or a sexual expression. So like around your relationships, relationship affirmation, how we use language to affirm people in their romantic or sexual or partner relationships. And then legal and medical affirmation are concepts that apply to trans and non-binary people. So legal affirmation is about identity document changes, that, like, for instance, your gender marker on your birth certificate or at the DMV, and as well as the name that is reflected on those documents. And then when we talk about medical transition or medical affirmation, we're often talking about gender affirming care, and that can include different medications, surgeries, hair removal, or voice training. And these concepts will come up throughout the day. Thanks, Monica.
Why is being SOGI inclusive or aware important? Being SOGI inclusive can have positive effects and impacts on the workplace or schools, as well as healthcare facilities and other settings. It can lead to a greater productivity, creativity, and innovation, as well as provide outcomes for the LGBTQ plus individuals who may have previously faced barriers in accessing services and or opportunities. So providers who are SOGI inclusive can create a safe and welcoming environment for patients. This increases trust, better communication, and effective treatment. Inclusive language and practices can also help to reduce the stigma and discrimination that LGBTQ plus individuals may face. SOGI awareness can also help providers make more culturally responsive care decisions. So being inclusive is important because it acknowledges and respects the diversity of people's sexual orientation, gender identities, and expressions. So SOGI inclusivity. Inclusive education raises awareness of and welcomes all sexual orientations, gender identities, and family structures. Inclusive education includes conversations about diversity as well. It creates an inclusive culture and prevents others from experiencing distress, discrimination, bullying, and for some, negative health outcomes. It's important to acknowledge and create an environment that respects and celebrates others' differences in gender identities and sexual orientation and expression. So some examples of SOGI inclusivity. Using inclusive language that is respectful and inclusive of all gender identities and sexual orientations. This can include using gender neutral pronouns such as they, them, instead of assuming someone's gender based on their appearance. Ensuring that people of all sexual orientation and gender identities have equal access to education, employment, healthcare, housing, and other opportunities and rights. And creating safe spaces where people can feel comfortable being themselves and expressing their identities without fear of discrimination or harassment. Overall, sexual orientation and gender identity means valuing and accepting people for who they are, regardless of their sexual orientation or gender identity. So I would like to take a couple of minutes for you all to think of some examples of what SOGI inclusivity in a behavioral health setting might look like. If you would like to put them in the chat, please feel free to do that.
These can also be examples of how you personally advocate inclusivity in your environment too, if anybody has any examples of things that they do. Perfect, thank you, Erin. So Erin highlighted like one of the big ones that's kind of a well-known, especially within county mental health, is diversity in staff, the gender unicorn. If anybody is not aware of the gender unicorn, give it a Google. It's very helpful and usually very fun animation. Signage representing LGBTQ. Just having that visual in the room, that's a really great example. No use of binary terms when addressing a group. That's a very good one. And then that's one that tends to be a little bit of a struggle. Wear she, her pin on my work lanyard. That's really smart. I like that. Just really putting.
I think just really getting used to wearing your pronouns or being conscious of them is really important too.
Yeah, and pronouns in your introductions, when you're introducing yourself with your pronouns, you're demonstrating like at least a cursory level of competence and understanding to people, and that it's okay, that you might be a safe person to disclose your gender identity or pronouns to as well. Same with the pin, sort of the same marker. Awesome.
Okay, perfect. Well, you all can keep putting your responses in the chat. I'm going to go ahead and move to the next slide. So I'm going to speak on cultural responsiveness. Cultural responsiveness refers to a set of skills that allows you to learn about and understand people whose cultural background may not be the same as yours. The ability of individuals and systems to respond respectfully and effectively to all people in a manner that affirms the worth and preserves the dignity of individuals, families, and communities. So what does being cultural responsiveness entail? Being aware that cultural differences and similarities between people exist without assigning them a value, positive or negative, better or worse, right or wrong. It's important to remember that this is an ongoing practice. It requires recognition of the impact of the organization's assumptions and practices, as well as recognizes, honors, and respects, and validates differences and similarities between people. So where do biases come from? Some come from an individual level, such as lived experiences, others at a community level, like family and friends, some society, history, culture, or media. When people realize that their actions contradict their intentions, they're motivated to act in a non-prejudiced way in the future. With practice, this self-regulation may decrease unconscious bias over time. So what are some ways to reduce this bias? The first one, deflect, reflect, and reject. So to detect, recognize when bias is present, whether in oneself or others. Reflect, think critically about the cause and impact of the bias to develop greater self-awareness and empathy. And then reject, take action to avoid acting on biased attitudes, challenge stereotypes, and create a more inclusive environment for all. And then negative emotional state increases the stereotyping. So imagine yourself in someone else's shoes or the other person's shoes. So now applying current best practices to help develop tools and improve services. Appropriate terminology, language is always evolving and people have different experiences and preferred terms. However, knowing the basic terminology helps everyone interact and speak respectfully to one another. It is important to mirror the language and pronouns that people use for themselves. To do this, we must first understand the language itself. So we do have a short video of an interaction and how it might play out in a work setting. In this scenario, I ask that you pay attention to the conversation.
I don't understand. Is it a he or a she? I don't understand. Is it a he or a she?
Excuse me, doctor. The patient you're referring to uses the pronoun she or her, not it. And we all know she deserves some respect, please.
You're right. I agree.
So if you or the residents have any questions about how to ask our patients about their identity, let me know. I'm a resource. We're a team. Let's do it. Let's work together.
Well, thanks. I appreciate that.
You're welcome.
I would just like to invite people to spend a moment to detect, reflect, and reject on what they've observed in that video, whether you're a provider or a staff member, but like what we've just seen demonstrated here is the best practice, right? Which is staff holding one another accountable for how we're treating the community. And, you know, there's some power dynamics that could be at play here, right? Yusuf may or may not also be a physician, you know, and there's also different power dynamics around like race and gender and different things like that. But I want to invite you to think about what it might be like to correct a colleague's language, or what it would be like to have your language corrected in a professional setting like this and how you might respond to that feedback. Okay, we've got a comment here from Lindsay that power dynamics at work can make this tricky. I wonder, Lindsay, that it could be seen as insubordination. Okay, I really appreciate that comment. You know, when we have policies in place in our health centers that require that we are treating people in affirming ways and respecting their gender and sexuality, then you know, holding someone accountable to those policies isn't an issue of insubordination, it's an issue of accountability. I really appreciate that comment though, because I think that a lot of times that we could be thinking about it in that way, or it could be received in that way if a provider is maybe like defensive to being held accountable, that could be the reaction is like, this is insubordination. So thanks Lindsay for volunteering that. That's yeah, it can be scary to invite people into accountability around this thing. And that's why, you know, it matters not only that we learn about what these best practices are, but we actually implement policies and procedures in our health centers to hold one another accountable. Yeah, and intimidating to speak up. Yeah, I think like, I work with a lot of like providers, and there's a lot of hierarchies in medicine in particular, right? Where physicians are at the top and may or may not be receptive to that feedback. That's an interesting comment. Ian, I'm noticing Patricia's comment here about that the provider did not address the person as it. So they did say, is it a he or a she? You know, I think that it's common for trans people to be referred to as it, to be like dehumanized in that way and objectified, and not using using it instead of using he or she or they is one of the ways that can function. And so yeah, I mean, I think that could be like maybe like a matter of perspective, but certainly like if I was referred to as an it, I would, you know, definitely feel mistreated in that situation. Yeah, cool. And are there any other comments here before we move along? Thanks everyone for volunteering your comments.
So overall, being SOGI inclusive or aware is important for prompting equity and inclusion, reducing discrimination and stigma, and creating a more supportive and welcoming society for all individuals, regardless of their sexual orientation or gender identity.
I'm going to start just before we get into like the California laws and best practices and how to actually collect the SOGI data. I just want to talk a little bit about the national political landscape, which I'm going to refer to a term that was coined by Dean Spade, who's a trans legal scholar, and I'm going to call this administrative violence. And administrative violence are laws and policies that legislate violence against LGBTQ people. So this is a map. This is from the project called Freedom for All Americans, which is actually, the project ended in 2022. So the map is a little bit out of date. I don't know if people are following anti-trans or anti-LGBTQ laws and policies right now, but they're happening daily and weekly. But in 2022, this is, an example of the states that had non-discrimination protections in place, and ones that didn't, and then somewhere in between. So you can see that we're in the red here. We're in California. We have full non-discrimination protections in place, and those have been in place for some time. But certainly, definitely the minority of states that do. And this is also from Freedom for All Americans. From 2022, there were 240 anti-LGBTQs that were introduced last year. There's already been more introduced this year. And the majority of these bills are transgender specific. The majority of them can be understood in 3 areas: targeting youth access to gender affirming care, excluding transgender youth from athletics, or restricting school curriculum. And then more recently, the Williams Institute, which is out of UCLA Law, they produced a report in March of this year. And at that time, 30 states had restricted or were in the process of trying to restrict access to gender affirming care. And that was, at that time, was impacting about 150,000 trans youth that had been identified. And there's significant impacts for these restrictions. There's a reason that we're talking about all this. So a number of these laws or bills actually impact families of trans youth directly. Parents can be framed as if facilitating access to gender affirming care as a form of child abuse. A couple of states have framed access to care as a form of genital mutilation. Other states have proposed or enacted laws that require employees, public employees like school employees or medical professionals to disclose to guardians if a youth is seeking access to care. 13 states are attempting to criminalize providers facilitating access to care. And then there's a number of bills as well that are trying to restrict funding or coverage of these services. And I just want to say here that, when we actually look at all of the literature, what is evidence-based as improving outcomes for transgender people is social, access to social medical affirmation, right? And legal affirmation, that those are the pathways to improve mental health outcomes. And so, not only are these actions not evidence-based, but they're actually cruel. And they're doing the very opposite. And we see that those consequences, but before we get into some of those consequences, we actually are not exempt from these bills here in California as well. There was recently AB 1314 that was proposed. In California right now, youth have the right to transition their gender and pronouns and participate in sports and other school activities that affirm their identity. And this bill would have made it, if it became law, it would have required schools to notify parents in writing within 3 days that they become aware that a student is wanting to participate in activities or is using a name that doesn't align with the sex that is either on their school record or of what they were assigned at birth. And actually, some good news is this was due to be heard in the Education Committee, and Assembly Member Al Muratsuchi, who is the chair of that committee, released a press release saying that he was not going to hear that bill. And I'll just read a little snippet from his press release. This bill would require educators to out a student to their parents, even when the student does not feel comfortable coming out, potentially forcing them into an unwelcoming or abusive home. As a parent, I believe that gender identity conversations between parents and their children should occur in a safe and private space. As the chair of the Education Committee, I will not be setting AB 1314 for a hearing, not only because the bill is proposing bad policy, but also because a hearing would potentially provide a forum for increasing hateful rhetoric targeting LGBTQ youth, right? So what he's really speaking to here is the perpetuation of stigma and a culture that is enacting violence against our community members. So good on him for not giving this more time. And so some of the stressors, right, there are actually there's actually research that demonstrates that having one's social status questioned or debated has a negative impact on youth. The Trevor Project has produced a study just this year, and that there's additional research that has been supporting this for some time. And then additional findings here, the CDC found in 2017 that trans youth in high school attempted suicide at rates 4 and 6 times higher than their cisgender peers, and that the Trevor Project has also found that LGBTQ youth, almost all of them, are concerned about access to gender affirming care. And parents, of course, are worrying about youth's mental health worsening and risk of suicidality. So it's more important than ever, you know, that we collect SOGI data and that we're able to like look at our biases, collect this data, and then deliver care in culturally affirming ways. So let's look a little bit more specifically at some laws in California here. So the first one is AB 959. This is the LGBTQ Disparities Reduction Act. And this law had really good intentions. It basically was stating that any state agency that provides health and human services should be collecting SOGI data as a regular part of demographic data collection. And we're going to get into the nuts and bolts of that in more detail today. And the reasons, the rationale for this bill is that we know that LGBTQ people experience pervasive health disparities, but because we don't have any SOGI data, there's no way to understand and address those health disparities. And then we have also no way of knowing if government programs are reaching LGBTQ community members or if those programs are effective or not, right? Because we're not collecting this data. So it is really important that we're collecting it. And actually, I'm not sure if anyone is aware, but just a few weeks ago, the California State Auditor released a report. And what they did is they conducted a review of the Department of Public Health's forms that they use to gather demographic data to measure like epidemiological kind of like findings across the state. And what they found is, you know, there's a very complex patchwork of like care delivery systems in this state and in this country. And they reviewed 129 forms that are used for demographic data collection and reporting like health outcomes. And they found that 105 of those 129 forms are actually exempt from the state law. So that's not good, that's not useful, right? And that's, you know, because like the forms were either deferred to counties for collection or to the federal government or like someone else. It was someone else's form that they were relying on. And so it was exempt from this law. And then of the 24 forms that were not exempt from the state law, only 17 were collecting SOGI data. So, it looks like this law looks great, but there's actually a real problem with it. And they're recommending, the state auditor has recommended an amendment to this law to take into consideration that that all of their sources of data or the majority of their sources of data should not be exempt from this law. And so like, I think this is like and I just want to say too, that the Department of Public Health was like, yes, we agree with this report, please fix this law so we can actually leverage this data and address these health disparities, right? So, you know, it is a scathing report, but it's also like, yes, this is the state of things and we're all in this together. And so this is kind of my plug to say like, hey, even if you're not required to do this, you can and you should, because we need access to this information so that we can like look after our community, especially in a culture right now where trans people in particular are so under attack, right? That we're seeing poorer and poorer mental health outcomes for our community since COVID. We need to keep an eye, we need to measure these things so that we can address them. And then the other bill that we're going to take a look at our law here is SB 179, the Gender Recognition Act. And this legislation makes it possible for Californians to have identity documents that reflect their gender. And so this only applies to state documents, but it means that on your driver's license and on your birth certificate, you can have a non-binary gender marker option. And And so by recognizing that gender is non-binary, that people are more than male and female, and that you can legally have that status, we need to make sure that when we are collecting data, that we're also providing those options, and that having a non-binary option is not an optional option, because it's actually a legal option for people to exist legally with an X marker. Does that land for folks? So, you know, if you are having a baby, you can legally have your baby assigned X in the state of California, and then you can wait for that person to grow and decide what their gender is, and they may or may not choose to like update their gender marker options. And then if you're also, you know, like a young person who identifies as non-binary or an adult, you can go and have your identity documents changed to reflect an X marker. So a lot of times, like, you know, I kind of wonder, like, what's the hindrance, right, to collecting this data? You know, well, there's probably a number of factors, right? We're all working under significant constraints, including like our technological capacity to collect this data, you know, time, right, resources, right? But also a lot of bias is actually informing that, right? And Monica has already spoken about that today. And of the studies that have been conducted on barriers to collecting this data, the SOGI data in clinical settings, we actually see that patients and clients are not resistant to collecting this data. It's actually providers that are making the assumption that their patients won't want to be asked these questions or will refuse to answer them. And, you know, of the studies available, we actually find that that's not true. That the majority of patients and clients are comfortable being asked these questions, and they will answer them. And that includes older adults. So that's really good news, right? It's an opportunity for us if we've maybe like holding back on implementing SOGI data collection in our clinics, or, you know, having influence over making this a priority, that, you know, that we might be the ones that are getting in our own way. That of course doesn't, you know, account for the other constraints, like how expensive and timely it is to update an EHR, or, you know, how we in our county may not have a data analyst available, or that type of thing. But, you know, any one of these barriers that we can remedy is going to facilitate this process. Okay, so we're going to do a little tools activity here. We're going to look at, here's a very generic looking intake form, right? So there are some things that we want to be paying particular attention to here. You know, we're asking about the client's name. We're asking about the client's gender, but we're doing it in a binary way, right? We're asking about their relationship status. That's something that I'm often like curious about. I wonder if sometimes it's not a particularly relevant question to ask. It might be relevant. And then, you know, maybe like if it is relevant, maybe examining what the response options are. You know, single and married are not mutually exclusive anymore. You know, other, it means a lot of things, and like no one ever wants to be othered. So we should always be cautious of using that type of language, right? And then for looking at parents and guardians, you know, not everyone has a mother and a father, right? There's lots of different family formations. So there's an opportunity to be more inclusive there, right? And then also we're asking about an insured name, and we know we need to gather legal information for billing and reporting purposes. There might be like a more useful way to do that. So here is an example of how we could like reframe the instructions on a form, right? While our health center recognizes all gender identities, many insurance companies or legal entities do not. Please be aware that the name and sex listed on your insurance must be used for insurance and billing and correspondence purposes, right? So we can ask, what is the first and last name that's on your medical insurance? what name would you like our staff to use, right? By only asking name at the beginning of the form, we're not really clear. Is that the name you go by? Is that your legal name? This like really trumps trans people up a lot. And it creates a lot of anxiety, and people might think that they need to provide their legal name. And then that creates a situation where your staff is automatically going to misgender someone based on client self-reporting, right? Well, that's going to get us off on the wrong foot. So instead, what name do you want us to use for you, right? And then asking about the sex on your medical insurance specifically, like that's where the documents need to line up. That's the part that matters, right? So that's where we can have our male and female options. You're probably going to want to check with your like what type of insurance you take to see if your insurers have updated their documents to have an X option or a non-binary option. I think probably in a lot of cases they haven't. They're not legally required to. They would be exempt from that state law that we were just looking at. But what we really need to know for the delivery of clinical care is what is someone's pronouns, right? So we really want to make sure that that is on our intake form. Okay, so now we're going to start looking at actually how to ask some of these questions. So now, first of all, I conducted a review of the literature to develop some SOGI data collection guidelines for the LGBTQ TA Center that I'm a part of. And there is like not consensus in the literature, I'm going to say that. This is an emerging area of study that is changing all of the time. And it's also really important, like we live and work in very diverse communities that are made up of people, different constituents, people of different ages and cultures, people with different languages and backgrounds. And so, while I think that it can be incredibly useful to say there's like one right way to do this all of the time, and we should just, collect this data statewide exactly the same, there's benefit from that. And also, if we're really working in like a culturally responsive way, then we actually really want to be in communication with our local communities and consult with them and collaborate to ensure that the questions that we're asking in the response options are like relevant and meaningful for them, that the language that's being used is accessible. And so I'm providing these as like examples, but you might find in your own process that you engage with your community and you consider some things that might be a little bit different. Okay. First of all, for collecting information on gender identity and sex assigned at birth, the best course of action is to ask a two-part question, ask about both of those things, right? A lot of research shows to ask about sex assigned at birth first before asking about gender identity. A more trauma-informed approach that reflects a lot of what the counties and the literature have done, and with community consultation, is transgender people prefer to be asked about their gender identity first and their sex assigned at birth second. And so that's the choice that I've made, as to reflect that is like what's in the literature, right? So here, when we are asking about gender identity, you can see that there's a non-binary option, right? Because legally people can be non-binary. So we want to make sure that we're including that. You can see that there's another gender identity option. So an option to write in your own gender identity. A lot of research out of the Trevor Project is that they ask this, and then every few years they'll change the response options that are available on their surveys as youth are using different language, because language is always changing and evolving. And then another best practice is that we always have a prefer not to answer option, right? So that people are actually not required to disclose this information, and they can opt out in a way that isn't like refusing to complete the paperwork. And then similarly with sex assigned at birth, we have the X option, because legally people can be assigned X at birth. I chose in this case to drop the word assignment from the second question and just put, what is your sex at birth? Oh my gosh, can you hear my cat? I hope not. Anyways, I'll just try to push through. So I dropped that because of the communities that we're serving on the California Reducing Disparities Project are a lot of like racial and ethnic minority communities that speak a languages other than English, and that word assignment can be confusing or not translate well. But again, you should always be doing what reflects your community and consulting with your community first. And then some other considerations here is that there may be limitations based on your EHR or your capacity to analyze data. So, you know, that might be something that you take into consideration about how many response options there are. And Leah will talk more about that later. And cool, I feel pretty good about moving on to the next slide. Oh, and so just to reiterate, these are questions that are asked of everyone, like youth 12 and older, as well as adults. And then we'll look at a child by proxy example in a moment. And then here's a sexual orientation question. And this would also be asked of youth 12 and older, as well as adults. We don't ask children about their sexual orientation. Most of them have not figured that out yet or are not engaging in like sex or sex practices. So the best practice is to not ask that question. So here you can see again that there is an option to opt out. There is also an option to identify with oneself with an option that is not prescribed by the whomever created the questionnaire. And then I've highlighted Two-Spirit here. It's important when you're looking at your demographic data collection overall, you really want to ask about race and ethnicity before you ask SOGI questions. And the reason for that is if you ask about SOGI questions and then you ask about race and ethnicity, what we find in the literature is that a lot of white people will identify themselves as Two-Spirit, and there'll be like significantly more respondents to that, to identifying as Two-Spirit than are identifying as Native American or Indigenous. And so we don't want to do that. Ideally, if you live or work in a community that has a high percentage of Indigenous people, that you would, and if you have the capacity, if your system has the capacity for it, you could have Two-Spirit populate as a response option to people who have self-identified already as Indigenous or Native American, but you wouldn't want to make that a standalone response option if that's not a significant portion of your population. Okay, and then we also want to provide a definition of terms. So this could be something that you laminate and hand out with your intake paperwork. It's giving an option for folks who might not know what some of these words mean to get an understanding of them so that they can complete this form more accurately. And this is out of a toolkit, actually, that was produced by, I think this one was Fenway. Anyways, it's included in our resources that we'll be sending out after the presentation. And then here's the child by proxy questions, right? So again, we're asking the two-part question, but we're including the language of boy and girl instead of man and woman here. Everything else is the same, right? There's the option to fill in yourself as another gender identity. There's the option to indicate prefer not to answer. There's an X option for the sex at birth. And the questions are tailored to the parent or guardian being the respondent rather than the child. And just to add as well that for adults, we wouldn't include questions that have language like boy and girl, right? We have culturally an tendency to refer to, you know, adult men as men and adult women as girls, and we're not going to do that. And now we're just going to watch a little video here. This is an example of a provider asking a youth about their gender identity and sexual orientation in a clinic setting, in a private setting.
So Lily, I'm going to ask you some questions about how you identify with your gender and your sexuality. And these are some questions that I ask all my teen patients. I won't share any of this information with your parents if you don't want me to. That's actually why I asked your mom to step outside and wait in the waiting room. However, I do need to mention that if your parents want to read what's in your medical record, they can do that. So I don't have to put anything in the record if you don't want me to. Just say so, okay?
Okay.
So the first question that I'm going to ask you is, do you think of yourself as a girl, a boy, transgender, genderqueer, or another gender?
Actually, I've never really felt like a boy or a girl. I'm just me. Sometimes people think I'm a boy, but it never bothers me.
That's great that you feel comfortable with who you are.
Thanks.
You don't need to make a decision right now about your gender, but I'd like to put a note in your record so that the next time that you come in, I can remember. Would you be okay with that?
Sure, that would be fine.
Great. I can put gender as other for now, which simply means that you don't identify with any of the other categories that we have in our system. Do you agree with that, or would you consider yourself male, female, transgender, or genderqueer?
Yeah, other is good. Maybe I'll change my mind the next time I see you.
That's totally fine. We can talk a little bit more about it now if you like.
Sure, that would be great.
In this scene, the clinician did several things well. First, she politely asked the adolescent patient's parent to leave the room so she can have a private conversation with the patient. Second, she made sure the patient knew that although their conversation is confidential, any information in the medical record could be read by a parent. She also asked the patient for permission to put the information in the medical record. Finally, the clinician was supportive and affirming with the patient.
A lot happened in a very short conversation there. And I see Stacy had asked a question in the chat, or has some questions about this data collection around parents and permission. So I wonder, Stacy, if some of your questions were answered there, or if you would like to chime in.
First, thank you so much for hosting this. I know that it's intended to be in a clinical setting, and a handful of us on the Zoom today are actually from education. And so I hope, Alex, that this is okay to, I just feel like you have so much knowledge, it might be really helpful to us to ask a couple questions related. So first is, you mentioned on one slide, the different options and demographic questions, and you said you recommend not asking children these demographic questions. So my first question is, what age is that cutoff that you recommend?
Yeah, I think about around 12 and older is appropriate for youth to respond to the questions themselves. You know, yeah, we also recognize that youth are capable of participating in their own mental health care, right? If they're 12 and older and they're demonstrating that level of maturity. So I would similarly, it might not be every youth, but you might be able to assess that around their development.
Thank you. And that is in line with our California Healthy Kids Survey, which is, right at that threshold as well with the grades. My second question is related to parent permission. So at the Orange County Department of Education, where I work, we have been asked, based on different funders of grants, to collect some demographic information about students, including SOGI questions for the services that we offer. And I know that our team really values this data and believes it would be important to collect. And yet we also have had attorneys who have interpreted, I guess it's ed code, state law, not exactly sure the laws they've all looked at, to say parent permission is required in order to even provide a survey to students that ask those demographic questions. So my question for you is, and then of course, when we have parent permission, it can be very challenging to get that back, to get a form back signed. You can, in fact, deliver the survey to my child because it has these questions in it. So is there anyone, I've asked a few times different folks, is there anyone who knows more about this and the laws and interpretation of it, whether or not parent permission is ultimately required to build in a demographic question like that?
I'm not sure that I can answer that based on an education setting. And I wouldn't want to yeah, I feel like that's something I would be really happy to follow up with you about and check in with some folks I know who work in legal services around and in education. But yeah, like I came prepared to talk about like a medical and behavioral health setting today.
Yeah,
And it's
I know.
a little bit different.
I could tell you have so much expertise, Alex, that I just thought I would throw it out there in case you knew. So I'm going to go back on mute. And if there is anybody that, you know, your organization recommends that we speak with,
Yes.
I know we would love to learn more.
Yeah, 100%. Let's follow up. And I see that Aaron chimed in with a comment at the moment that it's a very gray area. Aaron, was that in response to Stacy's question? Is there more you want to say?
Yes,
about that?
I think that our school district is currently kind of grappling with similar challenges in terms of parent notification and things like that. And then I think that schools are interpreting the law and to the best of their ability, but it's gray. So I think it's going to be a process is my interpretation, but no legal advice here for sure.
Thanks for that comment. You know, I am connected to some folks that do really great work in schools and with teachers and educators and yeah, like, I don't know if anyone's heard of Gender Spectrum. They're one of our grantees with the California Reducing Disparities Project, and they're doing some like really amazing work at the district level and with educators. And I think that they could potentially be a really great resource for navigating some of this and responding to your question. So I'm happy to follow up with you and facilitate those connections and access to information. Thanks.
There is a resource about serving school children with specifications on what can be done for grades 3 through 6. And it does say that they are required for 3rd through 6th grade to have that written permission. But once they hit 7th grade, the parent has to, the survey can be sent to the parents, and then the parent has to notify the school only if they don't want their child to participate in the survey. So it's kind of like the same age range that Alex was talking about, that like age of 12, where they can start really participating of their own accord. So don't want to give any like specific legal advice to that, but I'm not sure if it would be easier to like have just a general permission, if that would work. But we do have some, even particularly Orange County related education teams as part of CARS. So if you have questions specific to that, we do offer TA as well. And I can send I will be sending a link to everybody that participated to request TA. So they may be able to provide more information, because that's just a cursory glance that I did. So I don't want to give anybody like a hard yes or no, like this is the clear, but I don't know if there's a way to do like a workaround where you can send out survey information at the beginning of the school year or something like that. So sorry. I got a little redirected. So we are talking about using the SOGI data now, once we've actually decided what we are going to collect. And so we're talking specifically about when and why do you collect the data. So I'm going to elaborate on this a little further in some separate slides, but it should be taken at intake or registration. And then you're going to be updating it annually with other relevant health information. And then that's included with your demographic information at intake as well. As Alex said, you're going to be wanting to ask the demographic prior to the SOGI information. And then you're going to be talking about social history, depending on what you're collecting for as well. And so this is information that's going to be collected just like any other health information. And it should be collected for all patients, but you are going to have some that are going to opt out, but you're going to have the majority that are comfortable and willing to answer these questions. But by giving the option of prefer not to answer or I don't know, it gives you still a response for data you can work with, and will hopefully keep people from just disregarding those components or those questions. But even having that data is really helpful. But the goal of why you're collecting this data is to be improving your quality of care, and then making sure that your beneficiaries are receiving any resources that you can. So when we're looking at implementation, one of the key things is how frequently will the questions be asked. So we're talking about at intake, having the questions of what is your current gender identity, and what was your sex at birth, and what is your sexual orientation, and having those follow your demographic questions. And then the sex at birth is something that should be taken just at intake. It does not need to be updated annually, but the sexual orientation and current sexual identity can be added with social history at annual visits and asked annually. And then you can also have it so that you can present it to them as well, like with a note in the EHR if they to not have that updated per their request as well. And then the other key is who will respond to the patient inquiries about the questions. And so we touched on that briefly. It should always be the patient if it's someone 12 and up. If it's the parent answering the questions, it should be for 12 and under, and you're not going to include those sexual orientation questions. And you're going to make sure to verify what, if they're 12 and up, what they feel comfortable with having in their record. And then when you're looking at the demographic data collection at intake, you're going to be doing that ahead of the SOGI questions. And so your demographic data is going to be your age, your race, ethnicity, your gender identity and sex at birth, your sexual orientation, your California residency, your zip code, your active duty and veteran statuses, and then language other than English. So of those, everything is flexible to change other than race, ethnicity, and sex at birth. So those are questions that you do want to be updating on a regular basis, because everything else in there is going to, well, age is obviously going to change, and you may be able to update that automatically, but everything else does have the potential to change. So these are things that you want to be reaffirming and re-asking on an annual basis. And so when you're looking at why you're taking this data in, the two big keys are to improve your tools and improve your services. And so your tools are going to be your intake forms, your registration forms, your annual updates, your EHR data, how you're collecting this data, and then how you're inputting it into your systems. And by taking this in and improving your tools, you're making sure that your tools are more trauma informed and that they are improving the service experience for everyone. You want to make an environment that is focusing on whole person care. You want to make sure that your tools are there to affect mental health and physical well-being. If you're taking this information in, make sure that it's for a purpose, and that you're not collecting anything that's redundant, but that can be used to improve your tools and later improve your services. And so one of the big key places to start is looking at your language in your intake tools, in your registration forms, and making sure that you're intaking information. So right off the bat in a really respectful way that is going to be trauma informed. And so when we're looking at how to implement and how to collect this data, the key is patients should always be self-reporting. This is for the 12 and up, but you should not be assuming anything for a patient. You should not be leading them. If you can have them fill out the forms themselves, that's usually the best option. The SOGI information is going to be collected with demographic or social history like Alex was saying, we usually start with the demographic, particularly because there are some sexual orientations that are culture specific. And so if you have an automated system, like we're going to have a survey sent following this webinar. And so one of the things that I built in was if somebody selects Native as their ethnicity, that's the only way that they can get a two-spirit selection for their sexual orientation. So if you have systems that allow you to build like that, then you can actually avoid having people select two-spirit if they are not of Native descent. I know a lot of systems don't allow that, or if it's written, it tends to be a little bit trickier, but just having some kind of flag for yourself as well, it's helpful. And then that all the SOGI information needs to be collected within a private setting and updated in your EHR or your system manually. These are not questions that should be asked in an open environment. These are questions that should be asked and treated as HIPAA information. It's private information just as any other health information is, and so that needs to be treated as such. And so again, we're going to periodically update as we would contact information or other health information. And SOGI data is protected by HIPAA. And so that language needs to be written into forms. You need to make sure that they're aware that their information is private and secure. This is not information that, like one of the things in the video earlier that we saw where they were addressing the patient as that shouldn't even have been occurring in an out of the room setting, because that could also be a HIPAA violation. So that's another key to mention about that video as well. And so one of the things to do outside of your forms is to make sure that SOGI is implemented and incorporated through your entire system of care, so that it's not just forms or intake, it's something that's embedded within the culture of your organization. And so by doing that, you're showing that you're a safe space, that you're showing that this is a place where people can be comfortable to express what their pronoun information is, to be able to open up to staff. It just makes it a more welcoming environment, and making it so that anybody coming into the environment feels comfortable expressing themselves and identifying as they do. So a couple of the ways that you can incorporate SOGI throughout your system of care is having staff include their pronoun information, and making sure that it's in public facing ways. So if you have a provider list, or we have a lot of people here through education, and if you include your teacher's information on your website, if you have their name, include their pronouns. If you have lists of providers, just have their pronouns next to their names. Like a lot of the times, if they'll be broken out into alcohol and drug specialists or mental health specialists, on those forms, just include pronouns. If you have biographic information on websites, like staff directories, or even in such simple ways as like pretty much every mental health website is going to have information about their director, just have the director's name, their pronouns listed. It's having it even in just smaller places, the people that notice are going to feel more welcome, and having it embedded just throughout is so key. Having it on your business cards. I saw somebody in the chat earlier mention the email signatures. Having it through the culture and being visible and posted in as many places as possible makes it so that somebody is going to notice and say, okay, this is a space where I can comfortably say what my pronouns are. This is providing more culturally sensitive and relevant information to the public, making sure that you know who your public is. That's one of the keys to collecting the demographic information, the SOGI data. When you're analyzing it, it gives you a better idea of how much of your population identifies as a BIPOC or as someone in the LGBTQ community, and making sure that you have information in your main rooms that is sensitive to the communities that you're working with. SOGI data collection questions on registration forms can help patients feel validated and affirmed. And so just even having the questions on there and giving as many options or even the write-in options allow validation and affirmation from the people that are coming into your setting. When you are speaking, use the singular they or rephrase language you have to avoid he, she, binary on forms, employee handbooks, written policy, and things like that. So even on your internal forms, be utilizing non-binary and gender like open on, so you have the system working from the inside out. So you want to make sure that this is not only public facing, but staff facing as well. So where you can utilize he, she, consider using they instead, just so that there is a more comfortable gender neutral term used throughout your forms. When you use they, it has a liability associated with plurality, considering alternative words, the employee, the individual, or the person. And by using they, that's typical of language that is more inclusive.
You know, one of our participants made a comment earlier about having representation on your staff. And so, you know, I think that that is like so important, right? That people, like, part of your system of care is your staff, and seeing your staff reflected, reflecting the communities that you serve is like so vital for establishing rapport and making connections and people and having culturally responsive care. And so also when you're thinking about your like employee handbooks, it's like, do you have hiring practices for like how to hire trans folks or not, our LGBTQ folks? Are you thinking about updating your sexual harassment policies to be inclusive of gender identity and expression? Do you have a transition in the workplace policy so that when an employee lets you know that they are going to be changing their gender and how they're like represented at work, that you have a process in place already for that? So, you know, that just like, also like, you know, we can't like, trans people are not just like your patients and clients, right? We're also like knowledge holders and providers, and we deserve to be thriving, and that means being employed. And so like, please hire us, and also like do what it takes to support us to be in your workplace. That's part of your system of care. Thank you.
To capture what Alex just said as well, making sure that that language is within your organization, so that it does encourage not only trans patients, but trans employees and trans workers, and making sure that they feel comfortable in the setting as well. This slide is a little bit more directed towards those in the county side, but in terms of directing your cultural competency plans, by collecting the SOGI information, it's going to help you identify and address disparities. A lot of the times you're looking at the data of just ethnicity and culture, and by taking SOGI data and cross-referencing it with the LGBTQ data, you can get a lot more pinpointed on if you are seeing disparities within certain groups. So if you're seeing service information for your Black youth that identify as trans, and you're seeing disparities there, it gives you this ability to utilize the demographic information with the SOGI data to really pinpoint if you're seeing disparities within your services. By tracking those disparities, you're able to develop your plans and your tools to help address the disparities. And then this will also allow you to track and see if those plans and tools are working. So it's really important to incorporate both, because then you're able to give a more focused perspective and track more detailed disparities. And then you're going to be able to address SOGI specific needs in community and the individuals as well. So if you're seeing disparities within SOGI information, you're going to be able to track those and address those specific needs and issues that are occurring, and partner it with demographic data to allow for additional analysis. And so by doing that, you're going to be able to see where you need to do work And once you start doing the work, having that data is going to show you if what you're doing is actually working. And so it'll be able to help you develop your clinical tools and kind of tweak your plans as you go. So it's really useful to have somebody that can analyze this data for you to be able to tell you if you're seeing disparities, particularly within certain diverse or demographic groups. And so when you're looking at this data, you're going to have some ethical considerations as well. You might have some small sample sizes depending on who's going to respond. I know with counties, they tend to have, if it's not a part of their intake form, there's not a whole lot of survey response that occurs on its own. So by putting it with your registration and your intake, you're going to increase your sample size. One of the big things is risking confidentiality and that accidental outing. That's one of the biggest keys. Is you have to remember that it is HIPAA data and it needs to be treated as such. And if you use someone's pronouns without their permission in a setting outside of the clinical setting or outside of the medical setting, that is a potential HIPAA violation. So these are things that you need to be aware of when you're talking with the beneficiary as well. You need to be asking, okay, what are your pronouns? Are these pronouns you're comfortable with me using outside this room? What name do you use? Is that a name that you're comfortable with me using around your parents? Just really addressing and making sure that you know what's confidential to that person and what is not. If the person is saying, yes, this is the name that I go by, this is my name, and this is the name that I use with my family, that is something that we had seen pop up in the clinical side, is really assuring like what pronouns can be used if we call, what pronouns can be used if we're talking to you in a group setting, if we see you out, what are you comfortable with? So really making sure that you are aware of what the patient would like as confidential and what they would like as public facing. And then the data gaps. And so that is more focused on what you are missing, what you need to collect. And so that's something that you can kind of fill over time. If you're looking and seeing gaps in information, you can see if it's specific populations, specific cultures, and then start maybe working with staff of that culture, or if your county, if you have a community-based organization that you can work with, to say, hey, we're seeing a lot of this population not answering these questions. Are we framing this question in a way that's trauma-informed and culturally appropriate to that group? Is there a better way we can frame this question? With California, there's so many different individualized cultures and populations. If you have cultures within your community, it's really great if you can create connections and make sure that you're working with people of the same culture that you're serving, so that you're asking questions and framing them in a way that's appropriate to your community. And then that's probably like the biggest item, is making sure that you're asking these questions in a respectful way, that you're asking these questions in a culturally sensitive way, and that you're aware of who you're serving. And so that's the big key of why you're collecting this data and the importance of collecting this data. And then when you're looking at your SOGI data in terms of your EHR, of your health record system, there are a lot of little things that can come up as well in terms of ethical considerations, including billing issues. I know a lot of the older EHR systems will only let you utilize the name that's insured for billing. So if their insured name does not match the name that they actually use, that can cause some issues and potentially some trauma to have them be receiving all these bills with the wrong name on them. So there are things that you may need to manually work around around in order to address that. If you can have pop-ups within your EHR, if your EHR is a system that only lets you put in one name, maybe having a pop-up occur saying like, this is not the name, this is the name they prefer to be addressed, and highlight the name or pronouns the person utilizes. As EHRs are growing, they're developing more capabilities, but I know a lot of counties are still on older systems. So it's really into looking at what your EHR capabilities are and the potential workarounds. So is there a way that you can build in a pop-up if you have Cerner, or if you're with Anasazi, can you put in a picture that's the color of the pronoun they use? Like I've seen a lot of different workarounds to make sure that the person coming in is being referred to in the way that they want to, and a way to make sure that you are not promoting any trauma to the people that you're servicing. And now we are going to move into a Mentimeter scenario activity.
Folks, we're gonna be folks log into Mentimeter.
Oh, sorry, that's my bad.
Okay. We all are working on updating our language from time to time. Yeah, so we're just gonna do this is scenario activities. It's 3 kind of different scenarios that might happen in a clinic setting. The first one is communicating with someone on the phone, and then the second one will be kind of like an intake check-in scenario, and then the last one will be like an exit billing scenario. So please go ahead to Mentimeter.com and enter this code down here. We can see like 1 person has signed in so far. And we're gonna ask 2 questions in each scenario, I believe. One about kind of some challenges you foresee, or considerations, things you might be thinking about. And then kind of the second part will be tips to address those challenges. I'm just gonna stop here for a moment, and I can see the number going up on the bottom of the screen, so we'll just wait.
Also, though, for those of you that have not used Mentimeter, it is anonymous, or it should be anonymous. So feel
Yes.
free to submit your answers.
Yeah, thanks, Monica. This was actually Monica's idea that we use Mentimeter so that you can participate anonymously, and there's no like silly questions or anything like that. But this is really your opportunity to be like, this is what I'm afraid of, or I'm worried I'll do this, and you get to no one, your supervisor isn't watching or anything like that. So the first scenario, a client calls the clinic and they're going to make an appointment, right? And you're answering the phone. Okay, you can't tell the gender of the caller, and just remember, you can never tell the gender of a caller based on someone's voice. Speaking from my own experience, there's nothing I never get misgendered more than I do on the phone. So, so this is what we're going to respond to. So this is the question you're answering. What questions do you foresee trying to serve this person appropriately? What are you afraid of? What mistake might you make? What might you do? Yeah. Fear of calling them by the wrong pronoun. Thanks for that. Remembering she used gender neutral language. Oh, such great responses. Yeah. So one of the comments here, and I'm just going to use this as a teaching moment here, but asking immediately about their preferred gender pronouns. So we no longer use the preferred word. We just refer to gender pronouns, because the idea that it's a preference, it kind of like, I don't know, makes it seem more like trivial or like less necessary and important. And this is like really vital. It's not like, oh, I prefer pink to like purple or something. So thanks whomever made that comment for letting me use that as a teaching moment. Yeah, so these are all such great responses. So yeah, and so our next question is actually like what tips you might have for addressing these challenges. And a number of them were already mentioned in your responses there, which is so great. people are saying to make sure you use a non-neutral language. Don't make statements like sir or ma'am. Like to remember to ask. Yeah, you should always ask, like, how may I address you? Use their name instead of their gender. Yeah, that's what I always say to people. I'm like, please don't call me ma'am, just call me Alex. My name is Alex. That's what I use. Whatever you do, do not call me ma'am. So yeah, totally. Cool. And anything else? We've got one person's response here. Anything else that you can think of? So what are some tips to ensure that you're able to use gender neutral language? You can practice, right? Maybe practice, practice saying words like transgender, practice using they, them pronouns, practice answering a phone and eliminating gendered language. Yeah, using they as a default. I love that comment. That's actually when I worked at Gender Health Center, where we, primarily serve transgender people. Our practice was, regardless of what the name was, regardless of what someone looked like, we use they, them pronouns for every single person from the moment we received like an intake form or whatever until right up until we met that person and found out from them what pronouns they use. And then we would switch to the pronouns that they use, but everyone got they, them. A great tip is to practice with your pets. Your pets don't mind. Your pets actually a lot of times don't have genders. Their gender is like, my cats are cats, they don't know what pronouns are. So I practice with my cats. I use the given name. That's awesome. Cool. And yeah, and treating them with kindness. And I think that part of that is also just like apologizing if you make a mistake, right? Being like, I'm sorry, how should I refer to you? By your name? Great, I'll use that. Like, and just being humble and kind about it. It's really important to remember that the phone call is this person's first point of contact, and that there's the opportunity for someone to be like misgendered probably 12 times before they actually end up in the room with their provider. And all too often, we only give these trainings to providers and not actually all the rest of the staff, which to me is so frustrating, because your frontline staff are your first point of contact and your last point of contact, and a lot of those middle points of contact, right? The provider, yeah, they have the big salary and all the letters behind their name, but their window with that, your patient or client, is so small compared to the whole scope of your system of care. Cool. Yeah, definitely. So some things you could say, okay, great. Is the name you'd like me to call you, is that the name you want me to call you for today? What are your pronouns? Is there a different name on your medical record? And then don't use gender and sex data to confirm someone's identity, right? What's your date of birth, right? That isn't going to change, right? Cool. Let's move on to the next one. Okay. Oh, and we can move on to the next one. Sorry. Thank you. One more. Two more, actually. Go to the next scenario. Oh, okay. Actually, stop there. Stop there. Thanks. We'll get folks to respond here. How confident are folks with responding in this scenario? Go ahead and rate yourselves. Would rate yourself right now? Are you confident answering the phone and using gender neutral language? If someone corrected you, do you feel like you could adapt in that moment? Cool. Awesome. Most people are at least somewhat confident. That's great to see. The nature of these webinars and recorded webinars is we don't have you all in breakout rooms actually practicing, but that would be like the next step in the learning process. So I hope that you can make some time for that, or continue to seek out TA from us, free TA through our TA center, to have more in-depth training that's available for you. And we'll share the link where you can sign up for that. Let's go to the next slide, please. Okay, this is a little bit more of a complicated scenario. So a minor client and an accompanying adult present at the counter for check-in for the use initial appointment at your clinic. They need to complete the new client paperwork and demographic information. And let's go to the question. Okay, so what considerations might there be in this scenario? Yeah, we want to respect confidentiality. Are we talking to the child or the parent? Look, not making assumptions. Let's kind of pause here. What factors might determine if you are talking to the child or the parent in a scenario like this? The age? Yeah, totally, right? Cool. Make sure you know the child. Cool, cool. Yeah, so we need to consider the age of the child, right? If it's someone who's like 7, we might be talking to the parent, but if it's someone who's 14, we would be probably talking to the child who's the client themselves. Okay, and people are thinking about the paperwork, if it's culturally appropriate, and it sounds like some people may in the room may need to update some of their paperwork. That's great. Cool. And so then how to get the child. Okay, cool. Awesome. And let's go to the ways that we can respond. So again, folks are already putting some of the responses here. In the previous question apply here, but tips for addressing these kind of challenges. What could you say, or what tips might you recommend? Some folks had mentioned like determining asking question about the child away from the parent. Yeah, treat children with respect. Yeah, culturally we have a lot of adultism and embedded in a lot of our practices, right? Have your front desk staff take this training. Cool. Yeah, ask the child if they need help with the form. Cool. Sometimes there's like more than one form in a clinic. Sometimes there's like forms for people of different genders, or not everyone gets the SOGI questions, or the forms change by age or other factors. So you could just have like one form for everyone. Yeah, depending on their age, they can be a part of their own care. Totally. Let's go to the next slide. Okay, so the minor client returns the paperwork with the SOGI questions blank, and then the accompanying adult asks, why are you collecting this data from young people? It doesn't apply. The use is looking at the ground and they're not making eye contact. Okay, and we'll assume in this case the youth is like 12 or older. Okay, so what challenges do you foresee here, or considerations? You can go ahead to the next slide, please, Stephen. So we kind of have maybe a bit of an angry parent. We have a youth that isn't making eye contact. We didn't get the data wasn't collected, so we'd still maybe like to get an attempt at that data being collected. Right, we might be concerned about how aggressive the parent is. Are they going to escalate a situation? Are they talking calmly in a voice to the reception? Are they making a scene? Right, and whose responsibility is it to deal with irate parents? Another challenge that can sometimes happen in clinics, right, is oh, sorry, one second. something that can happen is like a lot of times our folks that work at the front desk are some of our lower paid staff, and sometimes acting maybe representing more marginalized identities, and then they're the ones that are kind of on the receiving end of anyone's like issues or complaints, and that's not cool, right? Yeah, so I love, this is so great, right? So harm reduction from the parent to the child, like maybe, are you talking about maybe separating them? Yeah, and so like there's so much great, y'all are a real brilliant group. So having standard positioning for like, we collect this information from everyone, it's so we can serve everyone best. You know, it's not like singling anyone out. This is just part of our standard practice. You have the option to, you know, prefer not to state. You don't have to complete these questions, they're optional. And we ask them of everyone. And a lot of that positioning was in the slides, which you'll get shared with you. And actually a lot of that positioning has also come from this really excellent health education toolkit that was just published last year. And we will include a link to that toolkit as well. If you are looking at implementing these practices in your health setting, then this toolkit can walk you through implementation from start to finish with like timelines and work plans and everything. So you'll get you'll get these resources at the end here so that you can continue. But you know, definitely like having standardized language and that all staff are trained on responding to them is really important. It could mean like maybe the parent's not comfortable with their own identity, totally. Sometimes the most offensive people are the ones who have something that they haven't addressed, or totally. Creating space for some gentle education, 100%, that's awesome. Cool, let's go to the next slide. So you've already provided a bunch of tips, that's great. But yeah, like what we saw in the video, right, where the provider, there's still an opportunity for the provider to ask the youth in a private setting to gather this data. And that might be really important for this youth, right? If they were looking at the ground, maybe they, you know, they did want to provide that information, and maybe they haven't let their parent know or their guardian know yet, or maybe they have, and that's why the guardian is so upset, right? And, you know, maybe that's related to the appointment, or maybe it's not. But so, you know, we still have the information to establish rapport with this youth and gather the information that is relevant from them, in this case, because we said they were over 12, but awesome. You all had great responses. Okay, and let's move along to the last scenario. Okay, so you have a transgender client and they're checking out at the billing desk, which I don't know, I think usually billing happens like at check-in, at least it does for me, but we're gonna have it at the end here, right? You need to verify their insurance information and take payment. Okay, so what concerns do we have here? Maybe some similar things to the phone call, right? Their insurance might not have their name, their correct name, the name and gender that they use on it. Yeah, totally. Yeah, if insurance info doesn't match the client's name, yeah, 100%. And so, awesome. Yeah, you're all on the same page. So then let's, so then how can we address that? Let's just go to the next slide there. So how can we address this concern that the name and gender might not line up? So we can ask the patient that what name and gender is on your insurance paperwork or on your insurance card. I just want to, reiterate that, hey, we're always going to use the name and gender that your lived name and gender, the name and gender you go by when you're here for your appointments, but we still need to ask this information for legal and billing purposes, like I'm sorry, it's not our fault. It's, still taking responsibility though. Yeah, and then maybe verifying their date of birth is another piece of information. Can make the explanation of why we need the insurance information and what we're going to do in clinic in our regular practices. Yeah, what you can do to help and that you understand. And, it's also good, like if you get, additional information relating to their name and gender, or, sometimes after an encounter, someone might share with you like, oh, well, they didn't use that name for me, in my appointment, or I was misgendered or whatever, then you can thank the person for providing that information and also be like, I'd like your permission to give that feedback to our staff so that we can make sure that our records are up to date accurately and that we prevent this from happening in the future. Yeah, and you address them by the correct name, 100%. Awesome. Great job, folks. That's awesome. That brings us to the end of this activity. So we have some time for Q&A now. If you want to, we can turn on the mics, or if folks want to message in the chat here if you have any questions, but we have lots of time left. Okay, thanks, Tech. The mics are open. If anyone would like to ask a question or maybe make a comment. Oh, okay. Why asking preferred pronoun is a problem? Yeah, so Patricia, that's such a great example. And I love how you're, using that you go by, like someone might go by like a nickname like Pat, right? So yeah, like that would be like a preference. But it's like the difference between like a preference and like something that is like needed, like necessary, right? Is like that's what the difference is, right? Is that it's not like optional to use my pronoun, right? If you use she, her for me, that is like invalidating of my identity, right? And so it's not a preference, it just exists flat, and so, yeah, or like, my legal name is actually Alex. It's not short for Alexander or anything else like that. I named myself and that's my name. So it's not a preference. It's like my name. That's what I use and it's what I go by. And like a legal status, like with a name or something like that, or like a gender marker, shouldn't be the indicator of if something is or if it's a preference, right? Because there's so many, and this is like wasn't the focus of our training today, but only about 30% of transgender people have all of their legal documents reflecting their name and their gender. And that is a huge barrier to like housing and employment and, all kinds of things for our community, and some of the reasons that we see such pervasive disparities existing. And so, if we are only relying on like legal definitions of what is and what isn't, then, we're like doing a disservice to our community, right? So we really just need to drop that preferred word, because it's not like, oh, I prefer like ice cream to chips. Like that's a preference, but I'm going to be like surviving just fine if I, don't get any ice cream and I get chips, but like what the research shows is that if we're not using the names and pronouns that people live and that reflect their true identities, then, we have poorer mental health outcomes. There's higher rates of suicidality. Folks are struggling. So it's just like not a preference. And so that's why we've dropped that word. I hope that helps. Yeah. What pronouns do you use? What are your pronouns? Exactly. Thanks, Lindsay. That's like really helpful, but we just dropped that preferred word. That's all.
Also to Lindsay, that same would work for your name. Like, what name do you use? What is your name?
Yeah, thanks, Leah. Are there any other questions or comments?
And then I saw in the Mentimeter that somebody had put that their forms weren't culturally responsive as well. So if you have specific asks about that, you can we can do TA for that for you, or if you had something specific you wanted to ask in regards to that as well.
Yeah, actually, maybe we can just drop the TA request button. I'm like looking for it in the chat here, and then if here we go. Oops. Copy. Look, I can do things.
Yeah, people do not love being othered.
Yeah, no one wants to be othered, right? I think that link is going to take you to our TA request form. Yes. So if you would like support reviewing your documents, reviewing your center's policies, your handbook, if you want, support updating your protocols, anything like that, our team has experience. Personally, myself, I've worked with a number of like health systems and counties and clinics to provide that kind of training and technical assistance, and I'm available to work with you and support you through that process as well. If you would like more in-depth training for your group or are looking for additional training opportunities, we have yep. So if in terms of like a workshop where you can actually get feedback from like live role playing, yeah, 100%. So we could like develop like pull something together like that for your group. You can make a TA request, but we also have prepared a number of resources for you. There are a number of free or sliding scale resources that are available where other folks out in the community, the Transgender Training Institute is one example of trans people that are doing this work. And the LGBTQ Health Education Center has a whole training website of different like self-paced modules and curriculum that folks can go through. So there's a number of different options that are available for you, and please peruse those resources. And then if you would like help either navigating those resources or having something tailored for your team, we're available through the TA Center to provide that TA for you.
Oh, and to reiterate that all the TA is also a free resource as well.
Yeah. And Lee, I'll turn it back over to you to finish up here.
We wanted to make sure we thanked everybody for attending today. And then if you have any questions, my email will be in that contact as well. We have a general email here so that if you have any questions and wanted to take that email down, that is a resource as well. And then we post a lot of our events and information on our Instagram, and that is run by Jeremy, and it looks very lovely. So if you would like to follow us on Instagram, we appreciate that as well. And so thank you everyone for attending.